Good evening, everyone. Hello. Welcome and thank you for joining us live again tonight on our mental health segment. We're back again and we're so excited. My name is Pamela Anderson, Parent Academy Specialist with Alachua County Public Schools. And as we often say, the Parent Academy is under the umbrella of Equity Department and the leadership of Dr. Antonique Edwards, our Chief of Equity, Inclusion, and Community Engagements. So since we're, our overall goal rather is to be committed to the success of every student, we're intentional in our efforts to empower parents and for success and for every student and families to achieve and succeed by providing invaluable information and helpful tips weekly to assist families and in learning and embracing new concepts and engagement strategies, which will then result in greater student achievement. So tonight, our very distinguished guests are here, and the focus will be coping skills for anxiety in this mental health segment. And I am very honored to have Dr. Griffin on, who is the Guidance Services Supervisor. She's listening in, rather. And Kimberly Joy will be, I'll pitch to her and she'll be the one to bring on our distinguished guests tonight, introduce them and share some things about her role as mental health supervisor. So parents, we're so glad you've joined us again. We're very happy about excited about providing these services each week. And we're glad you're tuned in and we look forward to having you each time you can. Kimberly Joy, our mental health supervisor with the School Board of Alachua County.
Thank you, Parent Academy and Ms. Anderson for hosting us this evening and giving mental health awareness a platform in our community. As Ms. Anderson said, my name is Kimberly Joy. I am the mental health supervisor in student services. Also, although Dr. Griffin cannot be on camera with us tonight, she is giving us abundance of support, but she is our supervisor of school counseling. So here at Student Services, it's our pleasure to work with our school counselors, school social workers, and community partners like UF Child Psychiatry and supporting students and families in schools throughout the district. With that being said, we felt it was important to highlight topics like stress and anxiety, subjects that are relevant to the current climate and developmental changes of that our students face, especially those transitions out of 5th, 8th, and 11th grade into new chapters of their educational career. Under any normal circumstances, these stages of change can be stressful and challenging. However, tossing a pandemic in the mix can definitely heighten those feelings for our children. With FSAs and the end of the school year around the corner, it seemed fitting to provide families like yourselves with a toolkit of information to help you feel more prepared to support students who experience these stressors. So on that note, we feel honored to have UF Child Psychiatry with us here today to speak more on identifying stressors, coping after major life events like COVID, and what resources that can be beneficial to combat these challenges. So without further delay, our presenters today are the esteemed Dr. Pumariega, who is also known as Dr. P, and Dr. Tieford from UF Health Child Psychiatry.
Okay. All right, so I actually need to, I think, be given access to the screen share. Whoever is the host could enable me as co-host so I can share. I think, let's see, will it work? Yeah, now it will. All righty. So can you all see the opening screen?
Yes, we can.
Okay,
we
great,
can.
fantastic. All right, so welcome to the session this evening, and I'm Dr. P. And Dr. Tieford, my colleague, is here with me. He's a senior fellow in child and adolescent psychiatry. I'm professor and chief of the division of child psychiatry. And we want to talk about coping with anxiety, but particularly within the context of the impact of the pandemic, which obviously has probably been the major source of anxiety for children and families and really most everybody in recent months and years now. but we're thankfully seem to be coming out of it. And we've got, I think now we still have to deal with many residual effects, particularly related to anxiety. All right, so a little context. To say that this is a stressor is probably an understatement. We're talking about a major, really disaster that hit the United States, and we've all had to adjust to. Over 77 million people contracted the virus. We had almost 1 million deaths. We're the leading nation in the world in infections and deaths. The current average is actually low, thank God. We have about 26,900 new cases a day on average, but our peak was almost 1 million. And we only at this point are having 270 deaths a day. But when we say only, obviously that still affects many kids and many families. And to put it in context, there's only one other experience that has caused more mortality in the United States, and that was the American Civil War. And out of its peak, we had 48 out of 50 states had positivity rates over 15%, many double digit. We are now, though, at a place where over 90% of the counties in the United States are classified as green, which is low risk. We still have a few of them that are yellow, Alachua County being one of them, although my understanding is the reason for that is we get a lot of patients from surrounding rural counties into our hospitals. So that puts us at a higher category. And we are at this point, we're at a point getting close to 70% fully vaccinated. And now the second booster is out. And obviously, it disproportionately has affected people over 65 with a relatively lower prevalence of infection in children and lower deaths, significantly lower. And lower hospitalizations. And most of those have been children with significant comorbidities or who've had major organ effects on their lungs, in their hearts, in their kidneys, or coagulation problems. But we probably have a significant number of kids who had COVID that are asymptomatic, and probably as many as half. 16% have been documented, but we think the over half of the kids with infections are asymptomatic. That's the good news, is that they're not affected. The bad news is they can be a vector for spread. However, on the impact psychosocially on kids may be as greater than the impact on adults. And we need to also highlight that a disproportionate impact of the stressors from COVID befell on our diverse populations, diverse racial and ethnic populations. Overall, Latinos and African Americans are 2 to 3 times greater hospitalizations, 2 or 3 times greater likelihood of getting the infection. For hospitalized, 4 times the rate of whites, also higher mortality. It's important to note, though, that in our country now, over 50% of kids are of diverse background. So we're talking about African American, Latino, Asian, Pacific Islander, Native American kids. When they're pulled together in the country, they are the majority of our children. And they've had to bear disproportionate stresses from the pandemic. And that includes because many of the families are frontline workers with high likelihood of exposure, low probability of remote work, high rates of comorbidities. They work in high-risk workplaces, have low rates of health literacy, of knowing how to navigate the health system. Sometimes they may even use denial just to be able to keep doing a tough job to earn keep for their families in the face of their fears. And you also have in diverse populations, multi-generational families with frontline workers, youth that are social, vulnerable elders, and that obviously increases risks. And that obviously can enhance anxiety even more. And when you're talking, and when you add lack of childcare, they are very much more dependent on going to live school as a way of recovering. So Dr. Tiefert now is going to speak a little bit about the psychosocial impact on on children and families in general. Then I'll come back and talk a little bit about a more clinical anxiety and depression, and then talk about coping skills. So Dr. Tiefer.
Absolutely. Nice to meet everybody. So, I'll add to what Dr. P said. And, I think one thing that, we often talked about amongst ourselves in our department is how, throughout the pandemic, there's been such an emphasis on, the physical health impairment from the COVID, whether it be, death that has occurred from people that have contracted it, or, the complications of the infection. But, mental health has not only affected those that have contracted the illness, but also, a widespread number of people who, have tried to deal with the pandemic as we're, waiting it out. So, and in our experience, this has affected a number of different specific areas. So, the educational impact with kids and allowing families to navigate how to change the structure of their kids' education depending upon, lockdowns and, case positivity within schools, the stress within families when it comes to worrying about, who may catch COVID, and when family members have caught COVID, the anxiety that's put on other family members as they recover, the stress for parents as they, try to figure out how to carry on their roles when taking care of their children, and then trying to do that while also trying to be safe and not spread the virus. Social impact for kids when it comes to a lot of the age groups that we deal with, especially adolescents. Being able to interact with your peers is such a huge part of, development. And in many respects, that's been hampered during the pandemic, and the social distancing and just not being able to interact with people as much as you would otherwise. And lastly, the development of different things that people would normally be doing, like recreational activities, and trying to figure out how to navigate those things in a safe fashion. Next slide. So when it comes to education, I think just about all of us, no matter what the circumstances, has been affected as parents. I know I have 3 children, and throughout the pandemic, there's been times where we've had to quarantine due to one of our kids testing positive for COVID, or one of the classmates of my kids. And then, at the beginning, everybody having to hunker down while we try to figure out what are we going to do about this. So, this is definitely something that I think we can all understand how this has affected, the educational system for parents. And, not only that, but teachers, as the pandemic first occurred, lots of teachers, felt that they were ill prepared for, being able to teach online, and it was just so, quickly implemented that, many felt like they didn't have a chance to really prepare things. So it was tough for educators as well. For a lot of families, the structure was also, a difficult aspect of it. When the original lockdown was going on, and also, whenever, schools had to temporarily close, having kids at home, even though, there were fewer people in the room, just, not having the structure of the classroom, created a lot of distractions for students, and put a lot of pressure on parents who happen to be home with those students to keep them on task, if they were, at home working. The fourth point, is something that I've had a lot of my patients talk about, specifically that, whenever there have either been lockdowns, or for students that have, took last year, did all their schooling at home, the lack of the live interaction and being able to ask questions, it's just such a difficult thing for students as they, listen to their teachers. And even though we have something great like Zoom, we all a difficulty, navigating how to use it and how to interact with each other while we listen to, whoever we're speaking with. And then, when it comes to just normal routine activities in the academic setting, like standardized tests, it became very challenging to figure out, okay, how are we going to do this safely? And that in many cases led to delays in these kinds of exams being conducted, and as a result, delaying in some cases, certain children transitioning to the next stage of their education. Next slide. So in addition to that, as I mentioned, at the onset, I mean, the stress of this on families and worrying about, how do we keep each other safe in our household and our extended family has been tough, and something that Dr. P and I have seen, a great deal. I know a number of my patients who have loved ones who happen to have, either immunocompromised states or other risk factors that make them, a higher risk for a bad outcome if they were to contract the virus. Has been a very stressful experience for them during the pandemic, and definitely something that has led to the onset of a lot of anxiety for patients that we've seen, and also exacerbation of it. And not only that, but for those of us who are healthcare workers and families of healthcare workers, the worry of all the different people we interact with throughout the day who often are ill, and trying to navigate how do we do this, take care of people, but also make sure that we're not harming our families. The internal quarantine that had to occur also, has been difficult. For those of us who may have tested positive or come in contact with someone with COVID, and having to separate ourselves from our families, try to figure out how the other members of the family are going to carry out the routines, while we're in quarantine is, been very difficult. And as you can imagine, that's created a lot of tension amongst a lot of families, and trying to figure out how do we suddenly, make up for, this person that's having to quarantine while we carry on our routine activities. And lastly, the disconnection that this initially caused for, those of us who have elderly loved ones, and in many respects, especially before the vaccine became available, this leading to some going months, if not years, without seeing those loved ones face to face, and that is something we've also heard a lot about in terms of anxiety, and even that developing into other forms of depression. Next slide. So, in addition to all that I've already mentioned, this has really put strain on families and parents in particular, trying to figure out how do I, ensure that my children are, getting the proper education, that they're having, normative experiences with their peers, but also staying safe. First off, for those with frontline health, who are frontline health workers, trying to figure out how can I, interact with my children, my family, without, spreading the virus to them. Parents have also had to deal with the stress of the financial stress of this when it comes to, the initial phase of the pandemic, when many of us had to, just sit out of work and, go for a chunk of time, either without pay or, without financial assistance, and then later on, once we all, have got to use to the pandemic, there being certain sectors of our economy that were underemployed, and how that's made it difficult to get certain services. And then, when it comes to childcare with families, at the beginning, a lot of daycares closed down, and suddenly, families had to continue paying into the childcare, paying for childcare, but not being able to receive it because of the lockdown. And similar to the lockdowns that occurred with schools, many daycares throughout the pandemic have intermittently had to close down if a certain number of students became positive, and so that's been very challenging. Next slide. The next, area, the social impact, is probably the thing that we've seen the most, especially amongst adolescents. And, it's, as I mentioned at the onset, this, interacting with your peers is such an important part of figuring out who you are and how to navigate the world. And for many of our adolescent patients, we saw lots of depression, lots of worsening anxiety, and just feelings of isolation. Even though we have this great thing like Zoom, it just doesn't, it's definitely not the same as seeing people in person. And as a result, it led to a lot of, children and adolescents to, really focus in on social media. We've heard all, the negative things that's caused, especially with things like Twitter and Instagram, and how it's affected the way children, conceptualize themselves and how they view themselves. And also at times, led kids to, not sleep as much because they were, on the screen a lot more than they would be otherwise. The not being able to see their peers, a lot of kids have found that the bonds have loosened, even though they may be able to see each other, on the screen. It's just, again, not the same as seeing someone face to face. So, a lot of our patients have mentioned that has been a big challenge. For those that are old enough to date, it's, tough to interact with those that you may want to date, but not be able to spend time together face to face. And then when it comes to social interactions, I know that there's been a wide array of different approaches to staying safe, and different families have different preferences about social distancing, masking, and that causing a conflict with peers not being able to interact with each other as much as they would otherwise. Next slide. And then the last section, there are different parts of our daily routines, weekly routines, and annual traditions that have been disrupted, whether it be extracurricular activities like sports, field trips that kids go on, or even holiday get-togethers, where we've either had to make it virtual or postpone. And these types of things have just been very tough, and made it hard to feel a sense of normalcy, and like the other things I mentioned have been something that have led a lot of people to feel anxious and worry about when are we going to be able to get back to normal. Next slide.
Okay. So given all these stressors that have really affected everybody, we now have to consider stresses that affect kids and teenagers who already have or are at risk for significant mental health or psychiatric problems. And we have a whole range of problems that can already pre-exist in kids, or kids can be at risk for, either because of their family history or because of other stressors that they're have gone through in parallel. And I like to kind of take each one and to give you a sense of how we've seen these problems. So, especially in the year 2020, we saw mental health need go through the roof. For example, when you looked at actual insurance claims for ages 13 to 18, they doubled for mental health over compared from 2019 to 2020. And that continued all the way through November 2020, though to a lesser extent. The claims for intentional self-harm, i.e., not only suicide attempts, but also cutting, they went to the roof. They doubled. Claims for generalized anxiety disorder, which is clinical anxiety, disturbance, they went up. They also just about doubled from 2020 to 2019. And claims for treatment of serious depression, i.e. major depressive disorder, also just almost doubled. Children's mental health related emergency room visits increased by 24% in the very young kids, 5 to 11, and went up by 31% in the age 12 to 17. Again, 2020 over 2019. That data is consistent with our own experience here at UF Child and Adolescent Psychiatry. Our inpatient unit had the highest census in memory during that period of time, from about April 2020 all the way through the end of 2020. The rates of inpatient and also our outpatient services. However, they've begun to decrease as of mid to late 2021, thankfully. So we're seeing certainly a lowering of the stressors and the lowering of a new need in a sense. Now, contributing factors, all the ones we talked about: isolation from peers, leading to loneliness, loosening of bonds with close friends, pandemic fatigue in families, aggravating pre-existing family conflict, stress around fear of contagion. All of them, though, weighing on pre-existing vulnerabilities. And for some youngsters, particularly teenagers, sometimes ready access to substances within the home. So it could be the family liquor cabinet, it could be cannabis, it could be prescription medication or opioids. One subpopulation, particularly kids with obsessive compulsive disorder, which is an anxiety-related disorder. Obviously, kids who have significant and serious obsessions and compulsions that interfere with their functioning. A common obsession and compulsion in kids with OCD is contamination fear, i.e., fear of getting dirty or fear of getting an infection. Well, guess what? There was a real one out there. And that really complicated those fears. Also, remember, we were hoarding a lot of stuff, a lot of toilet paper and food and sanitizer and all that. Well, hoarding many times goes along with OCD. And some of those behaviors that we had to engage in during the pandemic, that made the symptoms of OCD much worse. And in general, lockdown measures, everything from masking to a fear of contagion, made it worse for people with anxiety disorders and hoarding disorders. If you're gonna, if people with generalized anxiety, for example, have excessive worry, well, guess what? We sure gave them a big one to worry about, and it really aggravated. And that sometimes even became paralyzing. Already, people were locked down in their homes. When it came time to get out of their homes, they were paralyzed, and that has a name, and we call it agoraphobia, the fear of open spaces, the fear of going out. We've seen that with a lot of kids, and also in children and youth already have high rates of social anxiety, and obviously isolation and not interacting with other peers, not being around other people, heightens social anxiety, and fear of contagion aggravates it even more. We saw this also with other conditions, ADHD. Now, with ADHD, the kids, generally kids are very dependent on structure and consistency, which was hard to maintain when households were crowded and everybody was trying to work from home and the school from home. If you weren't super organized in how you did that, it really became problematic, and obviously there were a lot of excessive distractions in the home. A big problem for kids with ADHD who need distraction-free environments. Now, for some kids who had were able to get distraction-free environments, interestingly enough, some of them did better online and away from the classroom. Their problem was when they re-entered the classroom and the distraction in the classroom, and that increased their stress and anxiety. However, when you were in the middle of lockdown, and you had some degree of hyperactivity and impulsivity, oh my God, you didn't have many places to go. And many times when we saw kids like this, we told the parents, if they're outside, they're relatively safe. Let them run, let them walk, let them exercise in the backyard or kick a ball. Because otherwise it would create chaos in their homes. Sometimes that hyperactivity heightened impulsivity, which made it difficult for caretakers to engage with them. The caretakers became very frustrated. With autism spectrum disorder, you can multiply that by 2 or 3. Kids with autism spectrum disorder have major adverse reactions to changes in their environment. They need very predictable environments. a change in the environment or perturbation in their environment jacks their anxiety up through the roof. And they become very agitated, exasperated, sometimes aggressive. And also they're very oversensitive to environmental stimulation, noises, the lights, people, activity. And we saw many times increases in behavioral problems and acts of self-harm. At the same time, because of the pandemic, they had suspicion in some of the services that allowed them to cope, like speech therapy, where they could express themselves better, occupational therapy, where they overcame sensory sensitivity, behavior therapy, which helped them to gain better self-control. All that was disrupted. And it was a very, very difficult for them to learn online. So we had a major challenge there. Sexual minorities, LGBTQ youth. Again, isolation from affirming and validating peers and adults. They obviously had pressure cooker environments that led to greater isolation and conflict. They were at high risk for runaway behavior or suicidality. Already, they're about 48 times greater risk of suicidality than cisgender youth. We saw an even further increase during the pandemic. We obviously, as you saw from the data, we were really challenged in terms of access to services. I mean, even it's being able to serve kids on inpatient units. We have to isolate kids who were infected and have them in isolation rooms and use iPads to communicate with the nurses, with the doctors. And also we had challenges around outpatient services. A lot of families didn't have net access. We have some families that didn't want to wear masks or were uncomfortable. Some kids that had difficulty wearing masks, very young ones, or kids with sensory sensitivity like autism spectrum or had severe ADHD. When they were wearing masks, we had difficulty being able to tell nonverbal communication. All we could look at is the eyes. You couldn't look at the mouth, the lower part of the face. That's all very important to communicate and evaluate and get social cues. Psychological testing really went out the window. And as I mentioned, ABA services really require live observation. So it was hard to do on tele. Now, the one thing that came out of this pandemic that in some ways was a positive and allowed us to continue to deliver services, not just here at UF, but nationally, was the rapid adaptation to online televideo services. These are things that were being predicted for the future. Well, let me tell you, under the stress of need, the future became now. And this was both for psychiatric services and for therapy. So we shifted massively. We went from 90% live visits in April 2020 to we went from almost no televideo visits to 90% televideo visits by April 2020, then 62% started to decrease by September 2020. At this point, we're down to 40% televideo visits. We really have not experienced significant loss of quality or individualization of service. It's sometimes a little more personal and intimate. You go into the family's home, you interact with the parent, with the kid. Sometimes the challenge is getting the kids some privacy to be able to meet individually with us. But for parents, it not only obviously they were afraid of contagion, but also reduced travel time. They were able to make appointments. Our show rates, our percent rates of actually showing up were the best ever. And we used email or sometimes the electronic record to send rating scales, so to be able to send forms and rating scales. Our biggest challenge was that's the total number of services that we had to deliver. Sometimes being able to get like vital signs like blood pressures and pulses and things like that, and get labs on kids. So we encouraged families to still, let's say, go to a local drugstore or buy a little machine for blood pressure. But also we, at the same time, when parents had to go to work, we actually do three-way calls. We could talk to the parent, talk to the kid, in different locations. Now the real challenge for many people, particularly poor people, was the lack of net access. But many families got creative. We have many visits where the family actually drove to the school parking lot and tapped into the guest Wi-Fi to see us. So I was impressed, or to the local public library, or to the local health department. So I was very impressed with the resourcefulness of many families. And psychological testing gradually has been going more to televideo, so that's been helpful. But this gives you telehealth visits were down here. If you look, you see this little arrow, almost like infinitesimally small, and they shot up March and April to just about all our visits. And then and this is this magenta lines. Went down some, then went up some back in the summer of 2020. It has stayed about 40%. And the live visits went way down in green, then came back up, went down some during the summer, and we had a summer wave, then went back up. And so so these are the in-person visits. So coping skills. What are the things that we many times recommended to our patients, and we also recommend to families in terms of coping with this level of stress and anxiety? First off, one of the ways you can fight fears is with facts. There's nothing worse than fear of the unknown. Now, there's the technical term called intellectualization. And sometimes when you get too intellectual about things, it may be counterproductive. But having the information and not distorting things to make them, where it may be a small growling dog, if you're so afraid they look like a growling lion in our minds. So information shrinks that threat down. You prevent catastrophizing too. You try to help people to not see things in catastrophic or like earth defying ways, and put fears in context. Okay, so again, shrinking fears down to size. Relaxation techniques, especially ones that work for kids. Simple deep breathing, exercise, and exercise could be play for that matter. Counting backwards, even video games in moderation. Again, says the flip side of video games. Okay, sometimes for many kids on the spectrum, they have a autism spectrum. When they get very agitated, they watch a favorite YouTube video, and that calms them down. Yoga meditation techniques are very effective, can easily be adapted for kids. I really prescribe that many times rather than just purely relying on medication. And you'd be surprised how many elementary age kids can learn, especially the controlled breathing aspect of yoga and the mindfulness aspect when you focus on a certain object. And an object that you may have some anxiety interacting with, and then you just concentrate all your attention on that object while you work on your breathing and control your breathing, and you do belly breathing. Distraction. We underestimate games, spontaneous activities, getting silly, watching entertaining TV together. All those actually help to reduce anxiety. And also facing fears, or what we call gradual desensitization. Now, you can face fears in a catastrophic way too. I mean, if you push somebody in the deep end of the pool, they don't know how to swim. That's overwhelming, right? But what if they face the fear of swimming by first dipping their toe in the water, then going in the shallow end, then gradually working their way to the middle of the pool? If you can approach fears in this manner through gradual desensitization. You titrate up the level of the feared experience, and at the same time, parental support and relaxation coaching. You use any of these techniques above along with exposure, and eventually you can face most any fear in a very effective manner. Structure. It's so reassuring for kids, promoting normal daily routines and structure as much as possible. But this also means the parents. We sometimes tell kids, do this, do that, do your homework, then go to bed. Well, the problem is, if you tell a kid to go to bed at 9 and the parents are up till 11 or 12, that doesn't go well. Parents need to be role models, including around bedtime. You obviously want to in that structure include schoolwork, include chores, include outside time. It's got to be balanced, and also a regular sleep schedule. Um, you'd be surprised how many fewer medications we sometimes have to prescribe when kids get good sleep hygiene. Uh, Promoting social activities, and these days more live activity and less virtual. And that also provides appropriate distraction from excessive worry. When kids are with their friends, when they're engaged in play, when they're engaged in clubs or other kinds of activities or exercise, you can't do that and worry at the same time. It's very hard. You monitor online content and limit excessive time, especially content that raises anxiety or concern. You want to be aware of what your kids are watching online. You want to discuss it with them. Sometimes it's better to discuss and to process it than to say, don't do it. In fact, you might want to watch it with them and then say, well, what they're doing there, that's not the way it really works in real life. That's somebody, who's manipulating a video on TikTok. And then you can use behavioral approaches, particularly not punishment, but the use of reinforcers. You can use timeout as a contingency, but actually timeout worked for little kids and maybe elementary kids. Withholding video game time, controlling the Wi-Fi, or controlling the car keys works a lot better with teenagers. Or the other way around, earning it for finishing their homework, earning it for. I recently had a young man who, unfortunately, on the lockdown, became almost paralyzed at home, anxiety and depression. We had to use medications, but the only thing he liked is playing his video games. So he and his mom and I worked out a schedule where we rewarded him with a half hour of video game time for each thing he got accomplished. Everything from grooming to homework to make your regular meals, going to bed on time. 2 weeks, he is really back to full functioning, and we're going to get him back to school because he's avoiding school. So that's the goal. Dealing with coping with pandemic fears, but also really any fear. Open discussion. It's okay for parents to talk about things like the pandemic or other things, like, for example, we have a war going on in Europe right now. It's important to talk to kids about these things at a level they understand. And also parents modeling for them how you manage emotions about those issues. And that could include, for example, an open discussion about fear of contagion. With COVID, and sharing the concerns that the parents may have, but also the realities of the risks. You look up the factual information, i.e., again, information, facts, fighting fears. You reassure. Kids also need reassurance that parents are going to be with them and trying to support them. And also you work with them on practicing mitigation approaches. What mitigation approaches are reasonable to practice? And you also you want to promote healthy routine mitigation practice. Now, hand washing, for example, masking and distancing where it's appropriate, not out of fear, but where it's like, for example, if they're going into a space where it's very crowded and it's not controlled. And again, parent modeling is important. This is we're getting to the point of learning to live with the pandemic. I strongly recommend considering vaccination. They just approved the second booster. I'm going Friday. The doctors are the ones that first line up for vaccines. Let me tell you, that should tell you something. Open and direct problem solving for situational issues that come up around the virus or activities that may be involved. And so an open problem solving approach makes sense. Now, I think I would be very aware of not putting kids in a position where they are making decisions like almost parentified. They're the ones that are functioning as parents. Parents need to really be the ones in charge and providing reassurance. Live school attendance, yes. I'm very concerned about how many kids are shifting over to virtual alternative schools at this point that have gotten paralyzed and stuck because of anxiety in their homes. The live school attendance is best for mental health and ultimately physical health. Virtual alternative school carries the same risk as the lockdown. It just keeps reinforcing it. Keeps reinforcing. Remember, I mentioned that agoraphobia, that fear of going out. Yeah, paralyzing. That you can almost come up with a kid who ends up being disabled mental health wise as a result. You want to openly discuss about fears to return to school, not just obviously the virus, but workload, peer pressures, fear of bullying, interacting with teachers, etc. You want to help them balance school demands with active schools for social activities, not to get overscheduled, but also pick activities that the kids are really interested in and become self-reinforcing rather than having to get after them to do it. And then we have to try different activities. Not all kids are cut out to like the same things that the parents did when they were growing up or their siblings did. Request on-site access to a school counselor if there are anxiety concerns. A kid can pull out of the classroom and go meet with the counselor and have a quick session and process their fears, and then enable them to go back to the classroom and function the rest of the day. If they struggle with return, consider working with the school and developing a gradual return transition plan. That's a reasonable accommodation. Also ensuring learning supports. For a lot of kids, they've lost learning habits and habits for studying and habits for managing their homework. So and sometimes they even need a bit of organizational help. You almost have to use some of the same accommodations you do for ADHD, they may not have it. If you have concerns about virus exposure, obtain medical guidance. Again, back to use information rather than fear. And strongly consider mental health services outside of school if they're struggling with school return and all these other things have been pursued. It could be sign of residual clinical anxiety or depression. Okay. So that's the sum of what I had to share. And hopefully we have some time for questions. And I see we have some on the chat. Let's see, let's start. Okay, are we going to talk about kids being bullied in school, how to cope with the anxiety of that? Yes, let's talk about that. A very common fear. Now, I think that it's important for kids to realize that there's always going to be a risk of adverse interactions with peers. It's not something that you can always protect them from. However, it's important for them to know where their supports are, when should they go to the teacher, when should they go ask help from the school counselor. What do you draw the lines? You certainly don't want to encourage for them to become assaulted, or either verbally or physically. That's not a good thing. It's also okay to tell them that it's okay to get away, to not sit there and take it. It doesn't mean that they're any lesser person. In fact, they're the smart person who's not getting in trouble. Because unfortunately, when kids get into it, the one who starts it, it's always been my experience, the one who starts it never gets caught or rarely gets caught. It's the one who ends it. And so I think that's also important to work with kids around that and keep an open communication about any kind of bullying behaviors. And, sometimes parents may need to communicate back to the school and say, gee, my kid keeps getting, and the teachers can, because so many kids may not be picking it up. So if you bring them to the awareness, then they might be looking and seeing where that interaction is happening. And sometimes by the way, kids who bully, the studies have shown, are themselves kids who were bullied. They're bully victims, as we call them. And so so many times they need help. and something we need to address as well. Let's see, it's another question here. What are your thoughts in virtual mental health counseling? Due to my work schedule, my child's schedule may be our only option. Is it effective as in-person counseling? The answer, yes. Yes, 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 yes. It is absolutely as effective. I practice it myself. We have a whole division of psychology we're right next to, that all they do is counseling therapy, and they've become proficient at using virtual counseling. And mental health professionals are more and more being trained on how to use our Zoom like we do now, and our virtual tools. And it makes it so much easier sometimes for families. You don't have to, get in the drive from one place to go to the other one to take them here. Now, there are some rules. The kid cannot be alone, and an adult has to be in the room or in the space in the home. I think the parents should be there at least part of the time. Let's say if a non-parent adult is with the child in the home, the parent may need to come in from work, but they can do it by Zoom. They can maybe step out of the office a minute, get on the Zoom link. They appear like we do here, like Hollywood Squares, and we can interact with the parent and the kid at the same time. But again, this is the ultimate electronic generation. They know that kids are totally comfortable with opening up and sharing their feelings and doing psychological work on televideo. I've been so impressed, and let me tell you, that's not just here. That's national. I mean, my colleagues in child psychiatry, my colleagues in psychology, now we can't figure out how we did without all this. And by the way, I'll also add, there are services that are you can certainly go through brick and mortar providers who also do tele. There are also teleservices that that's all they do. There's one, I don't want to get into any conflicts of interest here, but I feel like this one's important because they actually serve kids on Medicaid, and it's called Children's Home Society. And they have a preference because they have a special contract with the state to provide services for kids on Medicaid. Sometimes it's very hard sometimes to get therapy for kids who are covered by Medicaid. These folks actually prefer it, and they have very good counselors, and we actually collaborate with them. And UF Child Psychiatry consult to their brick and mortar clinics, but and actually you can register online. So the parent can actually get on the website, register, you have to put in their information. The counselor emails them and says, okay, we'd like to set up an intake appointment. It's all virtual from the get-go. But there are also more services like that. Okay, what is the procedure for parents of students experiencing anxiety and depression to access counseling and testing through the school? Would my school colleagues like to tackle that? Maybe Ms. Joy can, and I can add maybe.
So they can definitely connect with their school counselor. We do have school counselors, and we do have school social workers that work together. I think it's really important to have that communication with them, because sometimes kids aren't that open with sharing their needs up front. So definitely somewhere to start, to have that conversation, to go from there. We do have contracts with other community organizations, depending on where the need is in terms of social, emotional, behavioral, and yeah, so that's definitely a conversation you want to get started first with your school counselor.
Yeah, and I've seen many kids who have greatly benefited from working in counseling therapy with their school counselors. This is they're a godsend, and we also work with some of the kids and those kids in our clinic. We have limitations on how much therapy we can provide in our clinic. So we and our psychology colleagues on the same floor, they're so filled up that isn't even funny. So school counselors are an incredibly great resource, and also community mental health centers, like Meridian, for example. I mentioned Children's Home Society. Chrysalis is now opening up some outpatient capacity and regular outpatient. So we're getting more options, which is good. That's I think good for our community.
I was
Dr.
just
P,
gonna
we
add.
also have one on, oh, I'm sorry, are you going to add before we go to the next one?
Yeah. I was just gonna say, yeah, I just wanted to also reiterate that definitely think school counselors are underutilized. And, very often when I have patients that I'm trying to get a therapist, I'll say, hey, at least see if your school counselor can start off. And in many respects, a lot of the patients I've had whose stress revolves around peer interactions at school or, academics, I'd say the school counselor is probably the most relevant person that can help you, since they may know the individuals you're, having difficulties with and sort of know the ins and outs of the school. So it's, yeah, it's a great resource that,
And something they can do with that knowledge is sometimes provide what I like to call social skills coaching. So you kind of like assume the position of a coach, and you work with the kid and help the kid, prepare the kid for dealing with that other kid who's such a problem in their life. And develop, okay, what are strategies for how you talk to this person? What are things you need to watch out for? What are things that you may have in common that you didn't know.
Okay, thank you. A question from the chat says, what if the children has a problem with the parent, so cannot talk freely? What if the children has a problem with the parent?
Okay. Well, that's why in any clinical setting or even school setting, it's important to give children their own space to talk about their concerns, because they can bring up their perception, their experience of what the problems are. Okay. Now, as much as possible, for counseling professionals, you certainly want to be an advocate for that youngster, but you also want to maintain some level of objectivity. Okay. And see, okay, so they're having a problem with the parent, and obviously, that it's important for them to be able to process that and to burden themselves in terms of their feelings, but also understand what might the parent be dealing with, and what are the stressors that that the parent is bringing into the picture. Now, what I find most helpful is to work first with that youngster, to get them to a point where they can actually talk about it with the parent and express it in a way that's not insulting or off-putting. And then actually, what can be very effective is to have a joint session where you support the kid, but they do the talking, and they start to work, lay out those issues with the parent, and then they can begin to process and negotiate together. Now,
Can you touch on specifically when they're referring to the online counseling, when the parent is required to be present from your presentation for telehealth?
They're not required to be, okay, it's important. The requirement is, that they be in the house, okay? In the nearby. Now, the youngster can have privacy in their room or some other room in the house to talk with the therapist or counselor or psychiatrist. Okay, they don't have to listen in. In fact, I very directly shoo parents away. Say, well, my time to meet with nighttime meet with so and so. It's just go over there and go. You got other things to do, and then I'll send Johnny or Keisha. I'll send them to go get you when we're done. Okay. So that's the signal, that they can come back in. And I usually try to get some feedback at the end of the visit, kind of to wrap it up. But it's very important that the kid have their own space. Now, yeah, that is a little more of a challenge, because you never know who may be like listening outside or anything. If I tell the kid, if there's something you want to tell me that you don't want the parent to know, why you put it on the chat. and chat, direct the chat to me only. So you can use those online tools as well. And that's okay. You can chat about those, and parents not going to hear that, and that's that obviously that goes away once you get on once you log on, especially if it's just between you and them. So that is, again, there are techniques like that that you can use, but I make it pretty explicit that it's important for me for the youngster to have private time with me, and if I'm in that role. And I think the overwhelming majority of mental health professionals will do that.
Definitely. And if anything, it takes pressure off of the child to request that private time, so that you can say, I want them to have this opportunity, without having them say, hey, mom or dad, can I talk alone?
See, there's another one here maybe. Would you recommend the same coping skills for a kid who already had anxiety and depression from previous trauma, whose anxiety spiked for any particular reason, or there are different coping skills to consider in that situation? Okay. If they've had experience of anxiety and depression from previous trauma, yes, you want to use those skills, but at the same time, they are going to need counseling therapy. Now, I also let them know that part of the therapy is not something that you dive into the deep end of the pool right away, but part of the therapy may have to be involved talking about the past traumas. Okay, and the reality is nobody likes to talk about past traumas. Okay. In fact, one of the symptoms, signs of PTSD that we all realize is called avoidance, i.e., avoidance of the memories. You don't want to think about it, and yeah, who wants to, right? I mean, they're painful memories. So what I usually do is educate the kids that we're not going to dive into those right away. We're going to work up to them and go at their pace, go at their comfort level. But at some point, they may have to visit those memories. And there's a particular reason. It's a little bit like, remember I talked about desensitization, like, you face a fear and you gradually approach it. Also, that's part of the technique in trauma-focused cognitive behavioral therapy, where you face the memories. And gradually, by facing the memories, they lose their power. And the person then realizes that they're in a very different position than when they experience that trauma. Usually when people experience trauma, they're in an utterly helpless position, and they feel utterly overwhelmed. Later, when they look at it, they realize all the resources they could bring to bear if they were in that situation. And what seems like, again, a huge elephant charging at you then becomes a lot smaller and more manageable. But that is very much a process of trauma-focused therapy. I don't recommend that parents push the kid to talk about the trauma, but if they bring it up to you, here's the difference. If they bring it up to you, yes, talk about it with them. Let them express their memories. Let them express their feelings until the point they no longer want to talk. When they don't want to talk, let them walk away. And that's okay. They got that far into it. Okay. That was progress. And you leave the door open. You say, if you ever want to talk about this, I'm here. I'll listen. It's not a taboo subject. But pressing them to talk about it can be counterproductive. But I'll tell you what's most counterproductive is when parents, and I've seen this sadly, kids have been through trauma, and the parents literally sit there and say, I don't believe you. I don't believe that happened. That is the most destructive thing that kids can go through. So I think it's important to not have that reaction. And for people who go through trauma, one of the very important things they need for coping is validation. Validation, at least of their emotional experience, and validation that that's how they remember it, even if the parent's memory may be different.
Okay. Dr. P, Dr. Tickford, this has been amazing, amazing data, amazing statistical information, amazing references and resources that we
Ms.
can.
Anderson?
Yeah.
I think we just had one more question in the question and answer. I'm so sorry. I just didn't want us to go without the doctors checking that out.
Okay.
Sure, thank you.
All right. So so last question here is, I'm concerned my child may need medication to help with depression, but I also want to try counseling. Mental health counselors and psychologists don't prescribe medication, but do psychiatrists do counseling along with medication? Okay. Yes. Many psychiatrists also do counseling along with medication. Okay. Now, in reality, the majority of the youngsters we treat with medication and collaborate with a psychologist or a mental health counselor and do collaborative treatment that way. But sometimes the psychiatrist, yes, can do both. Actually, I'm glad to see that, because of that question, because that, in a way, that's almost an answer. Combined counseling and medication is better than medication alone. That's research. That's fact. The studies are not something to be debated. Counseling alone, therapy alone, works for mild to moderate depression, but combination, medication and therapy, is what's required for recovery for moderate to severe depression. And believe me, sometimes we see the difference. We see kids where we got them in on very significant doses of medication, and then they finally can get into to see a therapist, and lo and behold, they turn around. So it makes all the difference.
Thank you so much for this valuable information, doctors. This is a topic that we can just go on and on about. All of our lives have had some experiences in the last year and a half, 2 years that, we just haven't had. And imagine those stresses on top of some existing things. So
if I can make a suggestion, maybe, we could do certainly topics, but one of the things I always have done in different places is to have sessions where people, parents can just come, or people really, parents, not just the kids in a given school, but, and we call the sessions Ask the Shrink. So, and you know what, it's those are valuable. People have great questions. And,
yes.
And I think from there you can get into different topics in a very productive manner.
Right. Great. That means we have to have you back. We're on a rotation. We can go on. And so it's going to be fabulous to have you back. We just have to put a comma there. We're pausing because you, of course, are distinguished guests, both of Dr. Tiefert and you, Dr. P. And most amazingly, our parents who's had questions and who have listened in tonight. We value you so very much. You are so important to us. And this is the reason we're having people like you, experts in different areas, come and share with our parents. And where would we be without our school counselors and social workers? So just a team of people serving and working together to help all of us see some sense of normalcy. Although we know some things may not ever be the way they were, there are some tips and help aids and some ways in which to deal with all of these things. And good things come out of bad things too, we know. So we're so excited about where we're going. And remember, parents, get information over fear. If you take anything away tonight, definitely take that with all of the information that has been provided. Again, phenomenal information, so many things covered that are important to us that we're actually experiencing and seeing in our lives and in schools and in our families from day to day. So we certainly appreciate your expertise. Hats off to our mental health team and our guidance counselor supervisor. And I will yield my thank you to everyone, Dr. Alduser, just the team of people that we just couldn't do this without each week. My director and boss, Dr. Antonique Edwards, are you there? So I didn't put that in the chat, but we'd love for her to come back and just say a couple things after Kimberly and Dr. Griffin. Would you mind? Or is she there? No. Kimberly, anything you'd like to add at the end here?
I just keep your communication open with your schools and your school counselors and social workers for sure. They're there to be there for you and your kids.
And Ms. Anderson, I'd just like to say thank you to everyone who participated tonight. The information was phenomenal. Parents, we do value you. We value your input. We are here for you. Again, Dr. Edwards, Ms. Anderson, everybody that participated, this was phenomenal. The information was great. Again, thank you.
Wonderful. And I just echo the sentiments of everyone. For all of our panelists, to you, Dr. P, and to Dr. Tiefer, thank you so much for being here with us. You know, as and of course, you know, our staff through Student Services, Kimberly Joy is now our mental health supervisor, which was very much needed within our school district. And it's a pleasure to have someone, especially when her last name is Joy, right? Because that's the direction that we're trying to move in. But also with Dr. Griffin serving as a supervisor to our school counselors, we really are trying to make sure that we are in a place where we know that, the district understands, the students understand, the family and community, that mental health is a priority for us. We have definitely been faced with many challenges, but we are not overlooking the great need of many of our students. And it was important to us to reach out to community members and people who are experts. Although we have our school counselors on campus, there are experts also in the field who specialize in particular areas. And when we have those resources around us, we know that it's important to reach out because we are better together. And we definitely want for that village concept to be brought. We want for parents to know that they're a part of our community. So with Ms. Anderson serving as our Parent Academy specialist, we've had lots of discussions, and our goal is to ensure that parents are getting opportunities to be engaged with the school district. So we are having these topical conversations and we're doing them online virtually, but that does not mean that we won't be using our mobile unit moving forward in our 22-23 school year, that we will not also have brick and mortar opportunities. Maybe we're coming to Ask the Shrinks in person. We've done some things like that before, and I think that would be awesome, right? And so we also want for parents to know that although we have centered ourselves on these discussions, as we move forward, we plan on releasing a survey so that we can ask you what you want to hear about. So your thoughts about what's important to you matters to us. So thank you for joining us tonight. And
Dr. Edwards,
everyone. Yes, ma'am.
I'm so sorry. I feel like the popcorn watcher. We have two things that just came up that are really significant to our participants, and I just wanted to make sure that you and all the doctors know about it. One was a question about the daughter being diagnosed by their physician regarding anxiety and ADHD, and how, doctors referred the parent to a school psychologist, but a private school psychologist, but what could the school offer? And then another participant asked how they could learn about or hear about monitoring screen use and for kids and teens. So those were the two things that popped up while you were discussing.
On the second one, if I could add, the American Academy of Child and Adolescent Psychiatry has a huge series of 2-page summaries called Facts for Families, and I'm positive they have one for screen use, and they're free to download, they're free to reproduce. aacap.org.
Could you repeat that one more time? I want to type it in the answer.
Yeah, it's so the website for the Academy is aacap.org.
.org.
And it's a series called Facts for Families.
Facts for Families?
Yes. And I'm sure they have to have at least one on moderating screen use, believe me. And also I'm looking at social media content and so forth.
Okay. And then Dr. Edwards, just talking to one of our parents who's one of our students has been diagnosed by a private physician and is in need of some support within the school.
Right. And I'm actually, I think that it's going to be appropriate. I can answer the question, but I would like to give this space to Dr. Griffin because she is the supervisor for our school counselors and can talk to you a little bit about the referral process that we follow for the district.
That is correct. I'm so used to you because you got your counsel. I know you're a counselor too, but yes, I'm so sorry, Dr. Griffin.
Right. We can do brief counseling with the student, but when it comes to diving deep into counseling sessions with anxiety and ADHD, like Dr. P said, a lot of times you want to do some parents, if you agree with this, may do counseling and medication all together, and by no means can we prescribe medication. So for it all to work together, we would probably do a referral out as well, instead of handling this ourselves.
One thing I'll add to that is that I know we've talked at length about, non-pharmacologic means to treat different, mental health conditions. ADHD is one where we will often tell families medicine is first line. So, if I would just add that if the physician hasn't brought that up, the medications for ADHD are really, without a doubt, more effective than any psychological intervention that could be added.
And I think in our portion, and adding to what Dr. Griffin did say for parents, is that to make those referrals, I think it really is important to share that information with school counselors, though. They may not be able to treat, and do that
Right.
deep dive that she was referring to, but being able to touch base with kids on campus and being able to make those adequate referrals to agencies in the community is really important. So I would encourage parents to have that communication with their school counselors for those services. We do have partnerships with several agencies, and we have our list in our and actually just relationships with various counseling professionals. And so please make sure, if you're not sure what to do, to reach out to your school counselor, because that's an avenue to get you to that next level of help. I think that's it, Ms. Anderson.
Dr. Alduser, is that it?
Yes, ma'am. I have not seen any more kernels pop.
Okay.
Well, thanks to all the families who've joined and to each of you, and know that we do this each week. Mental health will be once every 4 weeks. We have a rotation of modules. So I encourage you to go to www.sbac.edu/Parent Academy. You'll see what the focus is. So thank you, Ms. Arduzer, for helping us with tech, and Ms. Anderson for having a successful night. You guys all enjoy your evening.
Thank you.
Honey,
Good night, everyone.
Take care.
Thank
Thank you for having us.
Stay tuned. We look forward to seeing you guys again.